Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be performing the skill dressing change using Sterile Technique. For this video, I have my sterile dressing kit, which is already open due to practice. I have my hand sanitizer I'm going to be using for hand hygiene, and I have my biohazard trash container. So I'm going to enter the patient's room. I'm going to introduce myself to the patient. I'm going to have the patient identify himself, and I'm going to proceed. Knock, knock, knock. I'm going to close the door behind me for privacy. Good afternoon, Mr. Brown. My name is Terika. I'm going to be your nurse today, and I'm going to change the bandage on your wound. Is that okay with you? I'm going to perform hand hygiene. Okay, Mr. Brown, can I see your wristband? Can you confirm your name and date of birth? Okay, so Mr. Brown has confirmed his identity using two identifiers, his name and date of birth, and he has consented to having his bandage changed. So I'm gonna go ahead. I have already performed hand hygiene, so now I'm gonna apply my glove. Alright, I'm gonna take my glove and my sterile glove, and I'm gonna lay it on a surface that is flat, clean, and dry. Okay, I'm gonna apply my glove. Okay, so now I'm gonna apply my second glove. Okay, my glove is on. So this is going to be considered my clean hand. This is going to be considered my dirty hand. So now I'm going to clean the wound. So I'm going to take from my sterile dressing kit, I'm going to take my chloroplast, I'm going to drop it, and then I'm going to clean the wound from the inside. I'm going to clean the outside. Okay, and I'm going to toss it in the biohazard trash container. I'm going to take my clean hand. I'm going to take a piece of 4x4 gauze. I'm going to drop it, and I'm going to dry the wound inside out. So now I'm drying the inner area of the wound. I'm going to toss it in the biohazard trash container. I'm going to take another piece, I'm going to drop it, and I'm going to dry the outer area of the wound. Okay, I'm going to toss it in the biohazard trash container. Now that the wound is clean, it's dry, I'm going to inspect the wound. I'm going to use my fingers, I'm going to palpate the wound. I'm going to inspect for tissue type, color, odor, if there's any drainage, and then I'd measure if indicated. Alright, so the wound is nice and clean and it's dry. So now I'm gonna apply my transparent dressing. It's already open due to practice, or my Tecoderm. I'm gonna apply it to the wound. Okay, so I'm gonna open the Tecoderm. I'm gonna discard this part in the biohazard trash container, and then I'm gonna apply it to the wound. Okay, so I have applied the Tecoderm. So now I'm gonna peel the outer layer off. I'm just ensuring that it's sealed properly. The wound is sealed properly. Okay, so I'm gonna discard the outer layer. Alright, so now that I have applied the dressing, I'm gonna discard of my soil material in the biohazard trash container. Gonna discard. I'm gonna discard in the biohazard trash container. Okay, I'm gonna remove my glove. I'm gonna perform hand hygiene. Mr. Brown, are you okay? Are you comfortable? Do you need anything before I go? Okay, so Mr. Brown has verbalized that he's okay, he's comfortable. I have cleaned my hands, so I'm gonna leave the room and I'm gonna go document, and I'm gonna close the door behind me before I go.